The normal umbilical cord contains two arteries and one vein. A term umbilical cord is about 55 centimeters in length. Umbilical cords shorter than 40 centimeters are rare and may indicate fetal morbidity. Long umbilical cords can form knots, prolapse, or wrap around the fetus. About 1% of umbilical cords implant on the membranes instead of the placenta. Membranous cord insertion is associated with fetal growth restriction. A single umbilical artery may be an isolated finding. Congenital anomalies are found in 25 to 60% of cases with a single umbilical artery. Cardiac and urogenital anomalies are the most common with a single artery. Some experts recommend renal ultrasound for all infants with a single artery. Single umbilical artery is more common in twin pregnancies. Non-isolated single artery cases require karyotyping due to chromosomal risk. Single umbilical artery is associated with trisomy 18. Single umbilical artery is associated with renal anomalies. Single umbilical artery is associated with cardiac anomalies. Single umbilical artery is associated with twin pregnancies. Chorioamnionitis is an intrauterine infection or inflammation. It is diagnosed by maternal fever plus one or more of the following: fetal tachycardia over 160 beats per minute, lasting more than 10 minutes. Maternal white blood cell count over 15,000 per microliter without steroid use. Presence of pus from the cervical os. Positive biochemical or microbiological evidence in amniotic fluid. Rupture of membranes for more than 18 hours increases risk. Group B Streptococcus and Escherichia coli are common pathogens. Blood cultures and possibly lumbar puncture are used for diagnosis. Antibiotics are given to symptomatic newborns. Observation without antibiotics is possible in low-risk term infants. Risk of infection increases with lower gestational age and more fluid contamination. Placenta accreta is abnormal attachment of villi directly to the myometrium. It often occurs after uterine trauma like cesarean section or curettage. Placenta increta is invasion of villi into the myometrium. Placenta percreta is villi penetrating through the uterine wall. Placental abruption is premature separation of the placenta due to bleeding. Placental abruption is a medical emergency due to heavy bleeding. Chorioangiomas are benign tumors from fetal villus vessels. Large chorioangiomas may cause fetal heart failure and hydrops. Monochorionic means twins share one placenta. Dichorionic means twins have separate placentas. Monoamniotic means twins share one sac. Diamniotic means twins have separate sacs. Monochorionic, diamniotic placentas occur if division is between days 4 and 8. Monochorionic, monoamniotic placentas occur if division is between days 8 and 13. Dichorionic, diamniotic placentas occur with fraternal twins. Identical twins can be dichorionic if division is before day 3. Twin-to-twin transfusion syndrome happens when blood vessels connect twins. Twin-to-twin transfusion syndrome occurs only in identical twins. Twin-to-twin transfusion syndrome does not occur in all identical twins. The recipient twin becomes hypervolemic, polyuric, and polycythemic. The donor twin becomes anemic, oliguric, and develops oligohydramnios. Hydrops fetalis may occur in both twins. The donor twin has hydrops due to anemia and high output heart failure. The recipient twin has hydrops due to polycythemia and fluid overload. Twin-to-twin transfusion syndrome may be treated with laser ablation of vascular connections. Twin-to-twin transfusion syndrome carries a high complication risk even with treatment.